Next is Dr. Priyanka, and she will present a study of microvascular density and VEGF in eyelid and ocular surface tumors.
Good afternoon, one and all. The topic of my study is to study the microvascular density and the expression of vascular endothelial growth factors in the eyelid and ocular surface tumors. The study was supported by institutional intramural research grant. What we know is that tumor growth
This slide is not running.
What we know is that tumor growth and metastasis rely on the vascular support. The vascular endothelial growth factor is a primary angiogenic factor in solid tumors. The intratumoral microvascular density is an independent prognostic indicator. What is lacking here is the insight into the vascular pattern, which could guide us as anti-VEGF as a treatment modality. The hypothesis of my study was that eyelids and ocular surface tumors are associated with high vascular endothelial growth factors and increased microvascular density. The aim was to evaluate the factors involved in angiogenesis in cancerous lesions of ocular surface and eyelids using immunohistochemical techniques. To study the level of vascular endothelial growth factor and eyelid and ocular surface tumors, correlation between the microvascular density in VEGF, to establish a relationship between microvascular density and the features of tumors, which is clinical and histopathological. Also, to study the relationship of VEGF and the features of tumors, clinical and histopathological. There were cases enrolled over a 1-year period from the OPD as well as the oculoplastic clinic. These patients underwent total surgical resection, and after that histopathological examination was done. Relevant paraffin fixed blocks were taken out and immunohistochemical procedures were carried out for the evaluation of VEGF and microvascular density. The results observed were high vascular VEGF was noted in the malignant tumors, high microvascular density was reported in malignant tumors. It was interesting to note that the vascular VEGF expression within the tumors was highest in squamous cell variant as compared to the basal cell carcinoma and sebaceous gland carcinoma. Also, in tumors where we found high microvascular density, when we later look back, we also found that there was clinical aggressiveness also associated in the same set of patients. These are the immunohistochemistry slides. To conclude, our study showed vascular VEGF and microvascular density are significantly associated with malignant epidermal tumors. High tumor VEGF was seen in the squamous variant. High microvascular density is associated with clinical aggressiveness. Limitations were the small sample size. A longer duration of study is recommended for postoperative recurrences, and our studies lacked serum correlation. For innovation and advancement, institution of anti-VEGF therapy in squamous variant could be an option. Thank you.
Have you assessed the vascular endothelial growth factor through the serum of the patient or only through the biopsy?
Sir, actually in this study, we have only studied through the biopsy techniques, but we had also thought about this serum correlation.
Actually, the VEGF must be assessed through the blood sample serum, because the VEGFs are two types. One is the free flowing and another is a bound form. The free flowing VEGF, they are tumor marker. They are responsible for the metastasis, progression of the disease. So better go through the vascular endothelial, serum vascular endothelial growth factor.
Yes, sir.